Mercy Health and Youngstown State University are expanding their partnership to help some healthcare students pay for their education. The program, known as deferred tuition, would now help with initial out-of-pocket costs. Here to tell us more about it is Stacie Call, Chief Nursing Officer for Mercy Health Lorain and Youngstown. Thanks for joining us.
Thanks for having me.
So how does the deferred tuition program help with initial costs of attending the university? Who's the program available for?
So starting off, the program is available for the majority of our employees at Mercy Health Youngstown. And what it does for the employee is it allows them to not have the upfront cost of paying for tuition. So they can, apply to a program, get accepted, become part of the program, and we cover that cost of tuition for them, which essentially amounts to up to about $10,000 a year.
I was going to say initial costs, so about $10,000 a year. That can pretty much pay for your education, can it?
Absolutely.
Now, the U.S. is facing a significant shortage of people in healthcare-related roles. Some studies, like from the Bureau of Labor Statistics, have projected shortages of more than 195,000 nurses by 2031. Do you feel that programs like your partnership with YSU can help get more people into healthcare?
Absolutely. So the program allows people who are just unsure of where funding is going to come from for tuition to take an entry-level position at one of our hospitals. They can be a per diem employee, which means they only work a couple days, in a schedule. They could be part-time or they could be full-time, and it allows them to then have that tuition paid for. So they come in an entry-level position, and then they could seek out a career as a nurse, as a registered nurse, as a lab technician, as a respiratory therapist, or to work in imaging and radiology.
Do you think that it's those costs that maybe hold people back? They're like, maybe they don't want to go forward because they're worried about how they're going to pay for it.
Yes, I think it is the fear of the cost, unsure where those dollars are going to come from. We all are thinking about how we're spending our money, so we want to spend it wisely, and spending your money on an education like this is going to offer you a great career. And then in Mercy Health, we really look to make sure that we're offering the ability to promote within. So you may come into one of those entry-level positions, use the deferred payment at YSU or any of the other local schools that we have the program with. And then this allows you to continue to have inward mobility within Mercy Health to move up your career into other job opportunities.
Do you feel specifically for our area right now, where we've had some issues with Inside Health and various healthcare facilities closing, that this is something that could help in the long run with our local care shortage?
Yes, it will definitely be a benefit to us, even to those people who, already have a career but are looking maybe to change careers or have wanted an opportunity in healthcare. This is a great opportunity for them to, go back and get that education and not have to take on the upfront costs of tuition.
Yeah, what's your sales pitch here? What would you say to someone who's thinking about maybe getting into healthcare right now?
I would say this is a great opportunity. I'd also say this is a great opportunity for a parent. If you're a parent with somebody who's ready to go to college and you're thinking, what's tuition going to look like for us? This is an opportunity for them to come into the hospital as a phlebotomist or an aide or a care companion, work with us, and we pay for their tuition costs and their education.
And there's no better way to invest than invest in yourself. So Stacie Call, thank you so much. We appreciate it.
Thank you.